Okay.
So how's the
That's,
meeting? You gonna go to the meeting or how we gonna
no,
do it?
I'll have to skip it.
Okay,
So it's
okay. Thank you so much. We're gonna start. Just give me a second. We're gonna start. Let me call him and make sure if I'm not on air. Hold on. Okay. Hello, 1 2 1 2. So, hello.
hello.
Yes. Yes. Good evening, ladies and gentlemen. We are live in Adinkra Radio. Thank you so much for listening to us. Welcome back. I miss you all my viewers. I apologize. I was off for almost 2 weeks. I took a little break and we just came back. I am live in Adinkra Radio, Adinkra TV, Adinkra Multimedia, Adinkra Instagram, Facebook. You can watch us live right now in Adinkra. Thank you so much to all our viewers around the globe watching us live right now. We appreciate your help. My name is Ruby. You could call me Life is Precious, as I'm your co-host for tonight. Tonight we have a spectacular and a special guest all the way in New York City. She is coming to talk to us. She's going to introduce herself, and then she's coming all the way from New York Presbyterian Hospital, Columbia Presbyterian Hospital. Welcome, Doctor. Please welcome to Edinkra Life.
Hello. Thank you for having me.
You're welcome. Doctor, I appreciate for your busy schedule. You're able to join us tonight. Oh, I believe you are so busy. I'm so sorry. Abusuafo make kasa life ɛwɔ Adinkra Sabre, Adinkra Multimedia. Yɛbɛ kasa no, yɛbɛka yɛ kurom kasa kakra ne akapoto kasa no nso kakra. Mesrɛ abusuafo mo fa nkyɛ me. Almost 2 weeks nie. Mesrɛ kwan kakra me say take break. Ma messy me fans dodo mo fa nkyɛ me. Enyumre sɛ yɛhyia na ɛyɛ yɛwɔ doctor bi a ɔba bɛtu yɛfo yie, ɔbɛkyerɛkyerɛ yɛ nneɛma. Ɔyɛ doctor, ɔyɛ doctor wɔ ɔsa yɛ surgeon, not only ɔyɛ ordinary doctor keke, ɔsan yɛ surgeon, ɔyɛ surgery ɛma nkurɔfoɔ. Eti yɛbɛsrɛ sɛ mempɛ se mɛbɔ ne din koraa, ɔno a bɛbɔ ne din, introduce ne self. Ɔkasa free New York Presbyterian Hospital ɛmɛ sɛ ɛwɔ New York City. Mo a monim na ɛwɔ New York City. Mesrɛ bebree, yɛn nyinaa bɛbrɛ yɛn ho ase na yɛtie deɛ yɛ doctor yi ɛba bɛkyerɛkyerɛ yɛn neɛ. Mate sɛ de bia meka sɛ program yi is about health and business. Health and business. Yɛapɔmuden ho hia papaapa. Eti na nwumre yɛbɛka yɛapɔmuden ho asɛm, ɛmmaa ɛho asɛm, not only mmaa ne mmarima nyinaa. Yɛn nyinaa ɛba bɛsua biribi afiri mu. Yɛbɛma yɛ doctor no abɛkyerɛkyerɛ yɛn nneɛma. Na mowɔ question bi a mesrɛ abusuafoɔ motumi bi ɛka ɛwɔ ɛyɛ Facebook Live or Edinkra Facebook. Ubetimi akọ Edinkra app ne so, ukọ Edinkra New York, ubehu Edinkra Multimedia was so, ubetimi a download app no, utimi share live. Not only that, uko Facebook Live, Edinkra Facebook Live onso a ubenya, usako eye Twitter, ana Instagram, Edinkra Instagram New Yorker, ubenya, misro mumaye nyina, misro bebre de ahobrase, bekasa no man kase ya de bia se de meka no, mo fan cheme, misro bebre ye what your doctor wa how are you ready? Say on ye ba between komo. No what church ye niema, Madam Wase. Doctor, please welcome to Edinkra Studio. As I said earlier, I have a few questions. Could you please introduce yourself and tell us a little bit about gynecologist?
Yes, my name is Jessica Opoku-Anane. I am a minimally invasive gynecologist. That means that I do more robotic surgery through tiny incisions for women.
Thank you so much, Doctor. I appreciate it. Awesome. Ebusian Formuti also a gynecologist. ɛwɔ ɛmaa yɛapɔ mu den yɛkɔhwɛ ɛmaa mesim dodoɔ naa yɛkɔ hospital afi biara yɛ annual check-up yɛbɛyɛ. Doctor ne si yɛfrɛ no Dr. Jessica Opoku yɛ Ghana ni a yɛawo no kurom ha na ne twi kasa no ɔse ɔbɛka yɛ pɔtɔ kasa no bom ɛno mom ɔyɛ adeɛ kyɛ yɛ twi kasa no ba mo ka ɔte wo question bia ba modern former doctor yi Mr. Bebre yɛbɛka brɔfo kakra na yɛasa ka twi no nso ebiem. Doctor na introduce himself a chain baby a wɔwɔ enti me wɔ question kakra me bɛma doctor na aka kyerɛ yɛn. Doctor, please, I have a few questions for you.
Yes.
Okay. Can you briefly, as you introduce yourself, explain your background and expertise in gynecology and as women health basic? What do women normally do?
So as a gynecologist, I see women all throughout their lives, from the time childhood to adulthood, and even when they're much older after menopause. I take care of women who have problems, things like fibroids or painful periods, problems with fertility, or that just need routine screening for many things like certain cancers or things that can cause problems in a woman's health. I did my medical training at Johns Hopkins University and then my residency at Harvard University. And then I've been practicing for about 10 years now in California, in a University of California, San Francisco, and now at Columbia University.
Awesome. Thank you so much. I have another question. Osi abusuafo oko school wo eye Harvard University. Owie ye no osanko California. Esanko ye ne residency wo ho. Owie wasamba New York City. Eye one of the number one hospitals wo New York City. Eye Columbia New York Presbyterian Hospital. Oye surgery nso ema ma. Eti mesre bebre se ema mo waso ene yesro bebre me dia ahombrase pamucho moma yentie ye nuaba doctor afia na wo join ye wo ye doctor wa ha oni ye betwetwe nkomo owo phone so anu ye discuss wo question bia utimi bisa doctor na de bema. Doctor, I have another question for you. What are the key aspects of women health and that every woman should be aware of? How important is it regularly for our checkups, especially? And then what age should women start considering their pregnancies? What do you think, doctor? Tell us more about it. I'm going to ask one question at a time. I think it's too much for you right now. I'm sorry. I apologize. What are the key aspects of women health that every woman should be aware of?
I think those three questions, they're related. One of the things is that at all ages, there are certain reasons you should see your OBGYN, obstetrician gynecologist. Right. When you're younger, it means going for your routine screenings, making sure your health is adequate, making sure you're preparing for future fertility. And that's to try to prevent you from having problems and trying to get pregnant if that's what you desire. When you're older, you still need to go for routine screenings to look for complications that can happen as you get older, certain cancers that can develop, certain problems with your uterus or your womb, things like fibroids or ovarian cysts. So it's important to go not just to have counseling about how to stay healthy, but also to have screening for things we can prevent from turning into bad problems, and then also to get your regular examinations so that we can let you know if there's anything that you should address to help improve your fertility or improve your overall health going forward.
Amazing. Doctor, I have another question. I think a lot of women have fibroids, as you said earlier. As I'm speaking, I also have fibroids. A lot of women have fibroids. So in a case like that, how do women find out that they have fibroids?
The most common symptoms of fibroids are abnormal bleeding, often heavy periods or really long periods. Sometimes people will have pain or pressure difficulty with urinating too much, or constipation as the fibroids grow and they push on your intestines or your bladder. So those are the most common symptoms. Sometimes we will find out because maybe you're having difficulty getting pregnant. Those things, if you have those problems, you should see a gynecologist who will do an ultrasound or sometimes an MRI to look at the fibroids, see where they're located and how big they are. And then we can advise you about the next steps about how to improve your symptoms.
Interesting, doctor. Ladies and gentlemen, if you just joined out in that we are live in Edinkra right now, Edinkra Multimedia. We are live on Facebook. We are live again in Instagram. Please, we're talking about women health. Women health is very, very important. How women could get pregnant, how women can have all kind of diseases, ovarian cancer. The doctor's explaining a couple of things, and we have a lot of questions for the doctor. Ebusuafo emise meka ye kromu kasa kakra ye wa afia no wa join ye kasa wo Edinkra ye Edinkra Multimedia ye wubetimi enya ye sesia e wo Edinkra Facebook live ye Edinkra TV Edinkra ewo TV omo wo cable box enti se wo peso wo hwen so a utimi nto cable box no krakọ Edinkra app na wo beti yenka sesia ewo Edinkra ye wo ye doctor wa ha o chereche yen niamati afia no join ni yen ya misro bomodin na etie the doctor na eka ema yesra mu bebre we die ekofa not only ma emema die nso beba obeka ya pomudin ehu hia papa ye adwuma bebre esese ye bomodin se ye behwe ya pomudin. Doctor, I have another question. What are some of the common misconceptions about pregnancy that often encounter in your practice? I think a lot of women come over there and they have a lot of common diseases. Is there some of the diseases you could tell us tonight?
Yes, the most common ones that affect fertility are the fibroids, a disease called endometriosis, which can cause very painful periods, and a lot of pain, sometimes heavy periods as well. Other things that affect fertility, ovarian cysts. Sometimes if you have problems with your hormones, like your thyroid or other hormones that are in your brain, like prolactin, those can also affect fertility. But I think one of the biggest misconception is that all women are going to be able to get pregnant until they are in their 50s. And we all have these stories. Our grandmother or our great-grandmother had 11 children. Her last child was born at 52 or something like that. So a lot of women think that their fertility will last for a really long time. But for most women, the fertility starts to decline after age 35. And by age 40, it's significantly much more difficult to get pregnant. So you really have to plan for pregnancy.
Great. Did you ladies hear that? At the age of 35, high risk. Doctor, are you? A lot of women says there's a question that just one of our audience, Esther, just asked. What advice do you have for women who are trying to conceive? A lady just asked a question online right now. Her name is Esther. Big shout to our viewers listening to us. More questions are coming. The lady said, Esther, thank you for asking the question. She said, what advice do you have for women who are trying to conceive? What is your best advice for them?
The best advice is to try before 35, but even if you're after 35, you can do some things to help you to get pregnant. One of the biggest things is to be very healthy. Get yourself to optimal health, eat well. You want to eat things that are high in fruits and vegetables, fish, avoid a lot of fat. Make sure that you are exercising, that you have reduced your risk of things like diabetes and high blood pressure, because all of those may get worse during pregnancy. Then if you've done all those things to make yourself very healthy, eating well, and exercising, you should try to get pregnant for roughly about a year. If after a year you have problems getting pregnant, that's the time to seek an OBGYN or your doctor to start looking at certain things like your hormones, making sure your fallopian tubes are open, and looking for things like fibroids or cysts or endometriosis that might affect your fertility. And the goal is really to do that as early as possible because it gets increasingly more difficult as you get older.
Ladies and gentlemen, did you hear what the doctor just said? As you're getting older, things change, our hormones change. Doctor, a lady just asked, her name is Edith. Edith is asking whether back to the age 35, she want to conceive. She's asking, is it okay, although she's 49, is it okay for her? She never had a baby. She said she never had a baby. She would like to know at the age of 49, is it okay for her to conceive?
Yes, it's okay. So it can happen. It's just much harder as you get older than 40. It gets more challenging. As you get towards 50, it's even more challenging. But I'm glad she brought this question up because there are a lot of other options you can do. What it means oftentimes is that you may need help to get pregnant. So you may need to do IVF, in vitro fertilization, and there's many different ways to do that, or IUI. Sometimes it just means that you use your own eggs and you use your partner's sperm, they put it together and they put it into your womb, and that can help you get pregnant. That's IVF. Sometimes it's just that they take your partner's sperm, they put a lot of it into your womb, and that can help you to get pregnant. That's IUI, or intrauterine insemination. But there are actually more options, and I think most people believe in Ghana, or people don't do these things. These things are only happening in in the United States, UK, those things. But a lot of people are doing it in Ghana, and I know some very good fertility doctors in Ghana who are doing quite a bit. But those also include things like using a donor egg, meaning you use another woman's eggs. The best option is maybe a younger sister or a younger cousin, so genetically there can be some similarity. And then you may use your partner's sperm. They will make the embryo or the early baby and put it back into the woman's womb. So there are so many different options and ways to get pregnant when you are older than 35, 40, closer to 50. But sometimes you just need help with the fertility doctors to do so.
Thank you so much, Doctor. Another question that a lady named Mary, big shout out to our sister Mary. Mary is asking, can you explain various birth control methods available and the pros and cons with these birth control pills?
Yes, there are a lot of different options. The pills that you take every day, the patch you use once a week, and then there's a little ring you put into your vagina. That one you can use change once a month. Those are all the same hormones, estrogen and progesterone combination, and roughly about the same amount. Those ones, they work very well. Sometimes people will complain about weight gain, although most people do not have weight gain. Sometimes people can have things like breast tenderness or mood changes, but overall it's tolerated really well. And there's a small risk for blood clots in your legs or your lungs with any of the birth control that contain estrogen. Besides those estrogen plus progesterone birth control, then there are the implants that go underneath your skin, usually in your arm, that can last for up to 3 years. There's Depo-Provera, which is a shot that you get every 3 months. And there is an IUD, a little plastic tee that we put inside your womb in the office. And that one can last for 5 to 7 years. And actually 3 to 7 years, depending on which one you use. All the last ones that are just progesterone only. So you can use it even in people who have reasons why they cannot take estrogen, like certain people who have migraines or people who have heart problems or at risk for blood clots. They can still do the implants in the arm, the one in the IUD, or the shot, because it's just progesterone only.
Amazing, interesting. Did you hear what the doctor said? Abusian for doctor and say, ope se obi esi wawo bebre wawo 5. On peso obewu bium. Inti obisa se ye nua ba Mary. Osi yemisa se wawo 5. Na opesu ohun se 5 na wawo no. Obetimi anya any contraceptive pill anansi contraceptive injection bibi betimi a preventing isa onwu biom ana eno na doctor ne ka ho asem kakra or say there was so many IUD wo ho. Yes, there are so many. It be last even for 7 years. There were Lupron, there were iodine, there were so many. Doctor, I mentioned a lot. Eti kakra miss me to me a catcher when they say, "Oh, question bia." Doctor, no aha. Utimi bisa. Doctor, another lady just asked. Her name is Ajua. Ajua is asking whether what is the best one of all these contraceptive pills, are now contraceptive injections, are now contraceptive, whether iodine or whatever. Which one is the best of all of them?
That was the ones that work better are the ones that you don't have to take every day. So the IUD is probably the best. Sorry, I even forgot. There's another IUD that lasts for 10 years that has no hormones in it, but it tends to make your periods more painful and heavy. But the IUDs are probably the best because you don't have to think about it at all. You come in, you put it in 5-10 years. You don't have to think about it at all. It's very, very effective. It's actually even as effective as if you tie your tubes, but it's reversible. And that's one thing I wanted to mention about birth control. When I'm in Ghana and practicing in Ghana, a lot of women have been told that birth control will prevent you from getting pregnant, but that is not true. There is only one of the birth control that can make it a little bit more difficult to get pregnant, and that is the Depo-Provera shot.
Right.
And not that it stops you from getting pregnant forever, but it can stop you from ovulating for up to almost 1 year. So when you're trying after you get off of the Depo-Provera shots, it can be a little bit difficult to get pregnant. But all of the options, they're reversible. So once you stop, eventually you can get pregnant again in the future.
Ebusiafo munyina muti the doctor ne kai or see iodine ye nanso bibia your mu side effect. Another thing, doctor no onye only doctor or Columbia New York Presbyterian pill or sign a doctor or Ghana. You knew about Dr. Jessica. Work Columbia, Columbia Hospital. New York City. New York Presbyterian Hospital. Or some clinic. Ghana. Iti both Oshishan both America ha. And now say top number one. Maybe say one of the top. One of the top hospitals. New York City. New York Presbyterian. One of the top ones. Usha or Babesia Ghana ni ba abomodia ko school. Ese obechrechren ye niema enwumre. Etimi some abusia for nyina be nwan so. Ni etie more questions say ba. Doctor, lady, there's a lady named Abna. Abna said, Cynthia, okay? Cynthia, big shout to our sister Cynthia. Cynthia was asking, Doc, is it okay for her to have more contraceptive pills or contraceptive injection and still have a baby?
Yes, it's perfectly fine. The birth control does not prevent you from getting pregnant in the future. But again, the shot, the Depo-Provera shot, that one, it can take a while before you're able to get pregnant, even a year after you stop it before you're able to get pregnant again. So if you want to get pregnant soon, that's not the best one to use. It is a very good form of birth control. It works very well, but it's not ideal if you know you want to get pregnant within the next year. Maybe choose a different option than the Depo-Provera shot.
Awesome, awesome. Ɛyɛ abusuafoɔ mo te yɛ ɔse ɛnyɛ ne nyinaa na ɛyɛ ma yɛ yɛ misrɛ mo enti no wopɛ sɛ wowɔ a ɛkwan wɔ hɔ ɛwɔ ne other side effect ne pros and cons ɛwɔ mu eti wode ohia doctor na wofrɛ na yɛde ne number bɛto dwa mo frɛ na wo nsa bɛka no ɛyɛ yɛ nuaba Philomena ɔse yɛ misa sɛ what is the typical symptoms of menopause? Oh, besides, so many questions are coming over here. Thank you so much, our viewers. Obi, your friend, your new about, or say your friend Philomena, or say and can't you say, what is the typical symptoms of menopause, and how can women manage them?
Yes, typical symptoms of menopause are hot flashes. You wake up in the middle of the night, sweating, hot. Mood changes. You can get sometimes people get angry, sometimes they get depressed, their mood is all over the place. Weight gain, and then sometimes problems with sexual intercourse. So your vaginal dryness, it can be a little bit more uncomfortable, those type of things. But I think one thing that people don't realize is towards menopause, when you get to your late 40s, 50s, things, there's a lot of changes to your body. Your weight changes quite a bit. Your hormones are changing all over the place. So the things to do that can be helpful for menopause, some of them are you can do on your own. Diet, exercise, those things can be helpful. There are certain things like that are high in soy, tofu. People say yam, but honestly, there's not as much evidence for it. Black koshosh, which could be helpful to help you with the menopausal symptoms. But if your symptoms get really bad, then you can see the doctor, and we can prescribe you with some medications to help you with the menopausal symptoms. Estrogen, we can give you back estrogen. That works better than anything else for the menopausal symptoms. But there are some risks to using it, more risk of blood clots in your heart, in your lung, heart attack, those type of things. So you have to see a doctor to make sure that you are a candidate for it.
Thank you so much, doctor. A lady named by Antoinette. Antoinette is asking, thank you so much, Antoinette, for your question. Antoinette wanted to know, how does women reproductive health impact their mental well-being?
Oh, yes. If your hormones are not doing well, it can really change everything. It can change your mood. It can change your weight. It can change your cognitive function or how you're thinking. Can make you cloudier, difficult for you to think. So your hormones control so many things. If those are not functioning well, then it affects everything. But also, I think there's a lot of stress that happens for women around their reproductive health, in particular with fertility. There's so much stress on women about fertility. So many people think it should be natural, but problems with fertility are very common. Some estimates are as high as 1 in 6 women will have problems with fertility. That causes significant amount of stress for so many women as well.
Thank you again, doctor. Can you discuss the importance of prenatal? Back to women, a lot of women want to have babies, they are asking. So another question. Mm-hmm. Yes, another question came from our lady Cynthia. Big shout out to our sister Cynthia. Cynthia is asking, can you discuss the importance of prenatal care for high-risk pregnancies?
Yes, high-risk pregnancies there are many different reasons why you might be high risk. If you're older than the age of 35, if you have other medical problems like high blood pressure, diabetes, certain disorders like autoimmune disorders, things of that nature, can make you high risk. If you have any major medical problem, it puts you at higher risk, because pregnancy is just a big stress on the body. So anything that you have, it can make it worse, or anything you may have in the future, you can start to see in pregnancy. And if you're over the age of 35, your risk of high blood pressure in pregnancy and diabetes in pregnancy, even the risk of things like stillbirth increase after the age of 35. So it's important to see a doctor, a high-risk doctor who's used to taking care of those pregnancies.
Awesome. Doctors, thank you so much again for joining us. Ladies and gentlemen, if you just joined us, we are live right now. We're talking about women's health. It's very, very important. Our health is very important. That's why I said life is precious. Your life is supposed to be very precious for us. All of us, our life is precious. And the doctors is telling us a lot about our health, about women's health. A lady named by Patricia. Patricia said, Doctor, how can you find out that you have ovarian cancer?
Ovarian cancer is very tricky to diagnose. The symptoms are maybe you have bloating in your belly, you have pressure, pain, or you have problems with your bowel movements, those type of symptoms. But because you can have those symptoms with so many things, it's oftentimes ovarian cancer is not picked up very early. That is why it's really important to go see your OBGYN, your OBS-GYN, as regularly so that they can do an exam, a pelvic exam, and that is the screening test for ovarian cancer. If you have family members who've had ovarian cancer before, or who have cancers that are associated with ovarian cancer, like breast cancer or colon cancer, then you should go to your doctor to try to see about genetic testing, and they can test and make sure there's not something that puts you at higher risk. But for most people, it's the pelvic exam that you do with your doctor every 1 to 3 years. That's the way that you would pick up ovarian cancer. And other symptoms, if you're losing weight a lot all of a sudden, or you're having lots of night sweats and you're not in menopause, those things are other symptoms.
Interesting. Ladies and gentlemen, did you all hear what the doctor just said about the symptoms? Ovarian cancer is very, very bad disease that is bothering a lot of women, and then early detection is very good. So Edbusian for doctor ne say ovarian cancer is sema bebre nti yebemo monde say yebeko akoya test ama doctor ahwe wapomuden no say etisen say wo obi ana woni bi wo doctor na doctor, a lady named by let me see, Michelle just asked a question concerning the ovarian cancer. She said, how often should we go to check for the ovarian cancer? She is 52. Is it okay for us to still continue to check for ovarian cancer?
Yes, at 52, you should check even more. Ovarian cancer usually is diagnosed after menopause. So you want to go see your OBS-GYN doctor between like 1 and 3 years to do the pelvic exam. If they see something abnormal on the pelvic exam, or if you're expressing symptoms that they're concerned about, then they will order an ultrasound and check to make sure there's not a cyst on the ovary or anything worrisome. But it's after 50 that you should really worry about ovarian cancer. Before the age of 50, there are other cancers that you should also be checking for, things like cervical cancer, uterine cancer. Those ones we check for throughout at any age, but ovarian cancer, usually you tend to see it after menopause.
Amazing. Ladies and gentlemen, me pamucho muti dia ya Dr. Neka. Ovarian cancer ni ya reboni eti how often anasimpa yi ne bekwa ko hu ya doctor o say bomodin ko na ko ye test ni ya nhwe se ovarian cancer ni bia wenya 52 yenu aba Michelle o say yen kas wenya 52 no say yen bisa se okay se obetimi akọ check na se this year wakọ check next year so ehun ya se obekọ akọ check. Doctor, Michelle is still asking, she's 52, she's still asking that every year, is it okay for her to check? Although she checked last year, is it okay for us to do mammogram and then check for the ovarian cancer or do pap smear?
Yes, you should do your mammograms at least every 1 to 2 years. Your pap smears, it depends on whether they add an HPV test, but roughly between every 3 to 5 years for the pap smear, which looks for cervical cancer. The ovarian, you do your pelvic exams with your doctor once a year. That will look for ovarian cancer. So ideally, you should see your obs-gyne doctor once a year, and they will keep you up to date on which screening you have to do at what time.
Thank you again, Doctor, for your awesome questions. Ladies and gentlemen, yenua Dr. Jessica si papa yesua bibi new and many baby wanyansa ni obakufo trim. Enti Dr. Jessica onda anadwi or your doctor or science surgeon when ya adaji any ye twetwe nkomo kyerɛkyerɛ nneɛma eti abusuan for Miss Bebre me kasano man kase ya monsan fan chemi doctor ne se onna ɔse ɔdɔ yɛn ɔdwe yɛn ho eti yapɔmuden so hia no papaapa eti no ɔse yɛn mmɔmɔden si yɛbɛkɔ akɔ check yapɔmuden wadi 52 o wadi 60 o wadi 70 o ɔse ɛho hia ɛse yɛbɛkɔ akɔ check yɛbɛkɔ akɔ hu yɛ OBGYN doctor no wahwɛ yɛn. Doctor, I have another question. Oh, you're gonna need doctor and also Niema. Doctor, thank you so much. One of our viewers is saying you are awesome. You're a good doctor for your time and for your energy for helping us tonight to learn a lot tonight. I have another question from Diana. Diana is asking, is it okay for us to how do our culture factors, our social norm impact women health decisions and access to our healthcare, especially when you're old too much, they tell you you can't have a baby, it's too late for you to have a baby. She's 62. She's asking if it's okay. Diana is asking if it's okay that she could have a baby. She never had a baby.
It's having a baby is a little bit how much you want to spend. If there are lots of ways to have a baby at any age, but you would need help. You probably need to do some IVF, maybe use a donor's egg, somebody to donate the egg, because that's what gets old when you get older. Your eggs. You run out of eggs, or the quality of the eggs are not as good. But if you want to use someone else's eggs, you can get pregnant at we don't even know what the limits of age are. So at this time, we don't know the oldest person who can get pregnant with using a younger woman's eggs. We don't know. But you do have to consider that if you are a bit older, your risk of having complications in pregnancy also increase. So, if you are very healthy and you are older than the age of 50, but you're very, very healthy, that's different and that might be fine. But if you have a lot of medical problems and you are a bit older, then it might be a bit risky to try to get pregnant, even using somebody else's eggs.
Thank you again, Doctor. I think Michelle asked another question again. Teresa is also asking a question. Teresa wanted to ask, welcome. Thank you so much, Teresa. Teresa is asking if it's okay. Although you said 62 for that lady to have a baby, is it okay? She has diabetes, high blood pressure, emphysema, glaucoma. Is it okay for her to have a baby?
I can tell you it's not okay, but it's very risky with those things to have a baby. It's a lot more chance of having complications in pregnancy for you and for the baby if you do get pregnant. I think you should see, there are some people called the high risk of OB doctors, maternal fetal medicine, have a consultation with them. They can tell you exactly, after they look at your test, they see your results, they can say, this is way too risky to have a baby versus this is okay. But with those medical problems, it can make it a bit more challenging.
Wow. And ladies and gentlemen, did you hear what the doctor said? It's going to be challenging if you are 62 and you would like to have a baby. That is, it depends on you. You're high risk. Number one, you're high risk. And me say another thing, not only high risk, yare ben na wo different types of yare, wo diabetes, wo high blood pressure, wo emphysema. Obaku bisa yenya dayano see emphysema, diabetes, asthma, or ni nyina bi. Wadi 62, or person still owo. Doctor ne say yes. Obetimi awo hey abusuafo enwumre de esua ne ma o ewiase asesa tete no say oh when you 34 high risk you can't have a baby anymore and then there you 62 nyina wo. Hey doctor, this is serious. I never knew what to.
But let me clarify.
Clarify that.
It is very, very difficult.
Are coming in, doctor.
I know. It is very, very difficult to get pregnant at 62. Many people will recommend that you should not get pregnant.
Exactly.
Most people, if you are at 62, it's almost 100% those people who are getting pregnant are now using their own eggs. They are using a younger woman's egg, maybe a 30-year-old woman's eggs to get pregnant. So it's not impossible, but it's very difficult and it's high risk.
Amma just called to find out. Thank you so much, doctor. Amma just called. She said, doctor, she just had a baby. She want to know what time is it safe for her to be having another baby.
Ideally, she would want to wait at least 1 year. That gives her body time to heal and to it decreases the chances of her having complications in between the pregnancy. So I wait 1 year.
Ladies and gentlemen, when you have a baby, the doctor said the best advice is to wait at least 1 year to have a baby. Thank you so much, doctor. Ladies and gentlemen, if you are joining us right now, we are live at Edinkra Multimedia, Edinkra TV, Edinkra app, Edinkra Instagram, Facebook. We're talking about women's health tonight. We have our precious doctor here with us. Her name is Dr. Jessica, all the way from New York, Presbyterian Hospital, being with us tonight. Thank you so much, doctor, for your time and for your energy. We have another question. I think a couple of questions are coming. Doctor, somebody, let me see the lady's name by, I can't pronounce even the name. She said her name is Nana Kunedu Ajimai is asking if it's okay for her wife to have a baby, although the wife has 3 kids 3 kids already, and then the wife has a lot of complication. Is it okay for her wife to have another baby?
It depends on what the complications are. If the complications are with the heart and the lung, sometimes it's ideal not to have more babies. If sometimes if you've had multiple C-sections as well, after about 3 C-sections, you can have a lot of scar tissue that can make your 4th C-section, 5th C-section much more risky. So it really depends on what type of complications she's had in the past.
HIPAA law, she says she don't want to say it, but she says she has a lot of complications and she's asking if it's okay to have the 4th baby. She had 2 twins plus 1 and she would like to have another baby, but she has so much complications and she think it's not advisable. Her doctor said it's not advisable, but they telling her she could go to Ghana to have another baby. Is it okay for the lady to have a baby? She's asking.
She's in the United States, and then they told her she can go to Ghana to have another baby?
Yes, that's what she said. Her age is... She's 36, she said.
36?
Yes.
Well, I don't know what the type of complication is. I'm assuming it's not many C-sections. Sometimes if it's just you lost a lot of blood during pregnancy, I actually would recommend having the baby in the United States, because United States, they have huge blood banks. There's lots and lots of blood available. If it's because you've had high blood pressure in pregnancy, something called preeclampsia, and every time you have complications, it's risky for you and for the baby, maybe you shouldn't have another baby. It really depends on what the complication is.
Thank you so much, doctor. I have another question coming up from a lady named by Anesthesia. Anesthesia said she want to know if it's okay. She's pregnant. What are the things she has to eat to, because she's been throwing up a lot on her first semester? Is it okay for her to force herself to eat because she can't eat anything? Is it okay to eat some crackers, or what is the best advice for her?
Yeah, so I'm pregnant now, so I feel for you. I had the same problem even myself, but the best advice is to eat small meals. So more than, it's not ideal to force yourself to eat a lot of food. It's better to eat very small meals and eat frequently. So even if you just have, crackers now, then 2 hours later you have some fruit, and then 2 hours later you have something small. It's better to do small, frequent meals. Things that can make you more nauseous. Sometimes, if you things that cause like heartburn or reflux, spicy food, fatty foods, those things can make you not have reflux and have a little bit more nausea. Other things like ginger can sometimes be helpful for the nausea as well. But the biggest thing is small, frequent meals rather than eating a whole lot. It's when, oftentimes, when you feel really, really full, that's when you will feel more nauseous.
Wow, we have a lot of questions coming in, Doctor. I thank you so much for answering all these questions. I think I think time is not on our side. We're gonna continue this another day. The doctor, ladies and gentlemen, the doctor is her name is Dr. Jessica. She's a surgeon doctor at New York Presbyterian, talking to us tonight. It's almost 10 o'clock in New York City. 10:03 in New York City. But the doctor loves us so much. She still want to be with us. She's pregnant herself. She's pregnant. The doctor said, I should tell you, a lady named by Diana said I should tell you congratulations. Doctor, yeah, she said I should tell you congratulations. She wanted to know if she could come to you for a second opinion from a doctor. Is it okay to come and see you at the New York Presbyterian Hospital?
Yes, of course, I do many second opinions. Mostly because I'm a specialist, so I do a lot of second opinions. I'd be happy to see her.
She's asking, she find your name online right now. Is it okay? She find out that you are also a teacher. You teach. She want to know if you are still teaching the doctors.
Yes, I'm an associate professor at Columbia, so I teach medical students, residents, and fellows.
Ladies and gentlemen, did you hear about Dr. Jessica? She's also a professor at Columbia University, Columbia Presbyterian. She teaches the residents over there. Oh, Ghana for a Radia Shiraye. You will by Jessica, Dr. Jessica, oh, New York Presbyterian, or sign your professor. Oh, no, abrofono, a dear. Hey, Ghana for Onyamie Shiraye. Doctor, congratulations. Wakosku akwechiri esa chira brofo na de Ghana Onyamie Shiraye papa. See ye doctor waha osanyem 80 or experience papa osanye surgery. Ewo New York Presbyterian. Doctor, ladies and gentlemen, everybody on the line is telling me to tell you thank you so much for tonight, for your time, your energy, although you're pregnant and it's almost 10:03 in New York City and you still with us. That shows how lovely you are. They wanted to know your address, your phone number. Is it okay to put it on board for everybody to know? I don't know if you wanted to share your address where you can be reached.
Yes. So actually, when I'm in Ghana, I'm at Luca Health in East Legon. But I'm only there once or twice a year. And in New York, I'm at Columbia University. It's at 161 Fort Washington Avenue. In New York, it's Washington Heights. The phone number is 212-305-1107.
Doctor, could you please repeat the number one more time? 161 Columbia University. Is it Columbia Hospital, or they want to know if it's Columbia Presbyterian 161 Columbia, and then the phone number. They would like to hear it one more time.
Yes, it's Columbia University. That's the same as New York Presbyterian, Columbia University. I have many offices. One is in Midtown, 51 West 51st Street. One is in Washington Heights. That's 161 Fort Washington Avenue. And then there's also an Audubon clinic that's around that same area for Medicaid-only patients. But the number to call for all of those places is 212-305-1107.
212-305-1107, right, doctor?
Yes, and they will
212.
ask you where you live and which location you want to go to.
She has so many locations that you could reach the doctor. When you get to New York Presbyterian Hospital, you could Google it right now. You are online right now. You can Google it. Go to Google. Just type Dr. Jessica at Columbia University. Doctor, they want to know if it's okay to book an appointment or they could come in as a walk-in.
No, you have to book an appointment. But when you Google Opoku-Anane, because
Dr. Jessica Opoku-Anane. Go to Google right now. You can see Dr. Jessica Opoku-Anane. That's a Ghanaian doctor. A Ghana for Onyame Shirayen. Oh, we have a beautiful doctor. Oko Google Sesia. Ubo Dr. Jessica Opoku-Anane. Ube wuni Sesia ewo Google. Ukwa. O be show dodo. O ya me doctor. O sheme. Etine busianfo. Misro bebe fibroid. Mi ankasa mi wa mi wobi. Enye mebebe wo fibroid. Enya adi a yedi siye. Yaria ehama papa. Miss Doctor say, Doctor, somebody is asking again if the lady says she's bleeding a lot. Her name is Osimimbo Nidim. Me pacho, hold on 1 second. Osi a friend Kunedu Amponsa. Osi Bisa said, Doctor, is it okay? She's bleeding a lot. She has a huge fibroid. She see the commercial on the TV. Is it okay for her to be anemia? Because she's anemic right now. The doctor said she's anemic, and then she's been taking her vitamins. Is there any best advice for her to be able to get her blood back without taking any blood infusion?
Yes, there are many medications. There are both hormonal medications and non-hormonal medications. The one that I think people haven't heard of a lot is tranexamic acid or Listidia. That one has no hormones in it. You just take it 3 times a day for 5 days, and it will help you to stop bleeding. It just helps you to clot in the correct way, your blood to clot in the correct way to slow down your bleeding. It'll help with your anemia. Outside of that, any of the hormonal birth controls will also help you too. Sometimes people want to avoid birth control. So you have both non-hormonal and hormonal options that will help you with your bleeding, or you can do surgery to remove the fibroids.
A lady named by her name, we have a big sister over here. Her name is Mabna. Mabna is asking if it's okay what types of surgery they have for the fibroids, and not only fibroids. She want to know if she has a cyst. She want to know what are the types of surgery they could do. She doesn't want to do complete hysterectomy. Is it okay for her to have a different kind of surgery?
Yes, to tell you 100%, you would need to have imaging, so ultrasound or MRI, so that I could see the number of fibroids and the location. But there are different types of surgery. Sometimes we just go through the vagina and we shave off the fibroid from inside your womb. That's called a hysteroscopy. Sometimes we go on inside the belly. We go through tiny little incisions, like the size of a keyhole, and we put our long instruments through them, control them from the outside. So laparoscopic or robotic surgery. And sometimes we have to do a bigger incision surgery, even like a bikini cut, C-section like incision, or up and down on the belly. That's a traditional abdominal myomectomy. Those would all be the different types of surgeries to remove the fibroids that are not a hysterectomy. And then there are also procedures you can do. It's not surgery, but procedures to shrink fibroids, like uterine fibroid embolization, radiofrequency ablation, lots of different types to shrink the fibroids. But you have to see the doctor to, and most likely do an MRI. Then they can tell you which of the ones that you qualify for and that you can do for your fibroids.
Amazing. Thank you so much, doctor. The last question that I could take, because it's so much question, doctor. We can't finish it tonight, but we're going to bring Dr. Jessica Opoku-Anane another day. Doctor, a lady, I think our mother, her name is Ajua Mansa. Ajua is asking whether if it's okay. She's 78. She's having severe menopause. Is there any medication, or is there anything she don't want to take? No medication. Although the doctor is recommending a couple of medications for her. Is it okay for her to do certain, normal activities, or is it okay for her to take anything not medical side, like herbals back home? In Ghana we have our back home medications like a Fomedro. Is it okay for her to take all those stuff? Is it okay?
Yeah, the herbal medications, many of them do work. They're working the same way as estrogen. So, in the United States, we give estrogen, but the herbals are working to increase your estrogen. The only problem with the herbals is sometimes we don't know how much they're giving you or how much they should
Exactly.
give you. So, you have to just be careful about what you take. I tell you to take your herbals, but tell your doctor you're taking them, exactly which one, so that they can look it up for you, see what is in the herbal medication that's actually causing the benefits and what could cause risk. So my mom, she likes herbal medicine. I tell her it's fine, but she has to tell me what she's taking. Then I go on my database, I look and see, oh, it has this, and I double check and make sure there's not counteracting or there's not a
Right.
side effect with her other medications,
Right.
and I approve all of them before she takes them. But many of them do work. Most of them are working to increase estrogen. We don't study them, so it's not like it's hard for us to tell you which ones work very well, which ones doesn't work very well. Besides the black cohosh, which has some evidence for it, but it's not harmful. You just need to make sure you tell your doctor so they check out what's in it before you take it.
Thank you again, doctor. The last question, please. The questions are coming. I apologize for that, but we have to end our program because the doctor she has to go back to work tomorrow. She has surgery to do. So, ladies
Yes,
and gentlemen,
yes.
we're gonna invite Dr. Jessica Opoku-Anane another day. Last but one question, doctor. This is the lady said I should ask you. She's 78, and then she's having very hot flashes, very, very hot flashes. She can't sleep at night, although it's cold, but she's always hot. Is it anything she could do or eat certain food in order for her to get the hot flashes off her body?
So, medication wise, estrogen works the best. There's also low dose antidepressants. SSRI, like Paxil, any of the depression medications, those help a lot for hot flashes. There's a medication called gabapentin, it's a nerve modulator that works. But if you want to avoid doing the medications, the things to try to increase are things high in estrogen, like soy, tofu, um, things like yams, the roots, the yams, flaxseed, the black cohosh, which I mentioned. You have to get them a lot of times at those, health food stores. But sometimes those can also be helpful as well. And then exercising is also helpful for those side effects.
Thank you so much. Ebusianfo, yebema ye doctor wako wa bre. Doctors, thank you so much for tonight, for being with us for almost an hour and 15 minutes, for your precious time and your busy schedule. You were able to be with us tonight. Nyami unshra, God bless you. Ebusianfo, ye wo ye Dr. Jessica, Mr. Jessica Opoku-Anane, or ye gynecologist New York Presbyterian. So you may feel na wa joining ya yebema na ko na wa boy papa or see emripe no onyim sesi anyame boa no free mu a emripe mu no obesan ba any abetwetwe nkomo asan kyerɛkyerɛ ye niema. Doctor, before you leave, I really appreciate your time, your energy, the way you taught us tonight. I didn't even know a lady can have a baby at the age of 62. I learned a lot today, and we're going to put that in our pocket. I know a lot of questions are coming. They want to know if they could use the herbal medicine whilst taking the doctor's medication and then trying to get pregnant. And then a whole lot of questions are coming. I can't even answer all the questions. But before we leave, I would like to say a big thank you. And before we wrap up, you've been so precious to me. I've learned a lot. He's my doctor too. He's a very good doctor in Presbyterian. And if you like to go and visit, she's always there. She's awesome. She's amazing. She's a fantastic doctor. One of the best doctors. She's also a professor in New York Presbyterian Hospital. And your doctor, Dr. Jessica. Dr. Nyami Shrao, Nyami Nyokese. God bless you for your hard work and for your great education. I'll come and learn from you. I'll come to your class as a professor. Thank you again. And then good night. Good night. Thank you again. I appreciate your time and your energy. We appreciate. Without you, I didn't even know all these. I couldn't have done this without you. Thank you again. God bless you. Bye-bye.
Welcome. Good night.
Good night. Bye-bye.
Bye-bye.
Yo abusiafo say yesua nneoma bebre fi ye doctor ho. Doctor ni is so good. Osan your professor at New York Presbyterian Hospital, Coumbia. Our clinics bebre our Coumbia obo Dr. Jessica Opoku-Anane. Uko Google says see audio bo Dr. Jessica Opoku-Anane. Obesa ba be kire ye prostate emema musumu die oso obeba be kire ye nneoma bebre emre ni sa. Time ni sa esochina okoye ejuma said ye emre ne kono ye di besia enchebia ye be free before me free ha no yo encrophobia eso yasne ewa ha eye Ecobank ewo Ghana omo ye sponsors omo na ebo majumadie ekoso Ecobank for say omo to safre and say yes ro bebre upesu bie bank account ewo Ecobank almost say bomodin bra Ecobank ewo Ghana omu bema osika ama wodi aye dwumadie bia opeso wo not only that opeso bie eye dollar account ewo Ghana CD account and dollar account emu bia ombebo omuwe bie omu sawo eye loans omoma loans we hear loan edi esu dan ana we hear loan edi aye juma ni nyina ana de akokwanso Dubai ni Thailand ye ekosi uko Ecobank for wa omu sombema omu Samuel sika edi echecha bills nso afibia wachi ane nkakra ni nyina nso ye usi dan na uni sika kra udube su dan na osibra Ecobank for se momra obema muska obema loan ama odi esi ni wachi ane nkakra ene ska hwa ye din ska hwa ye din eniema boa ye din enti uko Ecobank for hwa ombeboa amwenye sika ama odi ye dwumadie bia opese oye omo number ye 011 Ufrefi USA 011233267114 01123326714306 Mitimubio 01123326714306 My homes my homes war Ghana almost omutunsa friend say upese usi dan anase my homes for Myla homes almost upese usi dan anase upe Airbnb upe baby dutiato uko Ghana bronya na ebe yo upese ko di holidays o Ghana na uni dan obedem kra free Myla homes almost de my homes for almost bra ombe ma dan dem omu dan eye boy kama emunsu ye okay eye omo Airbnb usan pefie nankasa tonso a ukọ ho benye bia ama wato omo no be ka ebo no wetua ne kakra opese wankasa unya nice place eda security wise omu security ye tight upe baby oda no wan se wada omu san wo swimming pool ewo ho omu ubi akra oda swimming pool mache nko ho obenya ho ada kodwodwo ho not only that omu san wo internet ewo ho misro omu some number ye 0233 530-360-462 033-530-360-462 anase se wo free figure na nso number ni 0530-360-462 0530-360-462 Reki's organic mixture almost say o pese o skin ye no me kama rashes bi ani hu o dark spots bi anase o huna matwintwam almost say bra ombemboa ma skin na ye kama no me kama omo number ye emu US omo number ye 917 836 3155 917 836 3155 almost say bomodi an say obeba abema skin de aduane pa shatare pa de aduane pa makacho se programmi uni ho amini ho. Big shout to all my listeners, big shout to all my fans. Nyami shromu nyina. I'm so sorry say me say me take it 2 weeks break me this shromu fan cheme yasamba back Miss Robebre this weekend Edinkra Heroes Night. Oh my goodness, last year was so beautiful. This year better than last year. Ebusian for Saturday by November Edinkra for to suffer obi bia wa America ha almost mombra wo New York City mombra be hwe Edinkra for mo pay hu your life me we Edinkra Brian na meji yani Edinkra Heroes Night baso wo Co-op City almost say omo the address na ebe mayen na mesro upe ticket ni bi ato bo modern bra ticket ni $100 upe VIP $150 ticket ni son one man tema unya ticket ni bi okuo bi mu a bo modern bisa ukuo ni se mu Edinkra open number edi afre enya ticket ni bia free nu abema oji me the number betudwa o se mo pe ticket na ebi wo ho mesra busianfo allow me to enjoy myself but modern so be Edinkra Heroes Night by Saturday Thanksgiving weekend US ha Edinkra Heroes Night misro bomodi couple dancing shoes couple water papa bi shena fabra Edinkra dress to kill Miss Busianfo jajumane kakrato na beji wani Edinkra Heroes Night ekuoku wa America ha eni nkrofo abom modern krom ha award edi abomabaso ama makoso ayede omoye nyame hira Edinkra for say yetun safro obi bia Saturday we this coming Saturday Empire Beja. It's going to be serious. Eti bomodi so baba beji wani edumane ya din stress ne dose America ha enti wo ho a na wa jiwani enye yenko an yebeko ena enye wedding ko you Heroes Night yebeko Edinkra bomodi se obeba ababeji wani Edinkra Heroes Night ho mesro bebre uni me pacho uni your friend is saying uni ticket ni bia but modern friend ye nua be ma oji unsa beka ticket no address ni ye 177 177 pamucho mo fancheme 177 wo Co-op City 177 Dresser Loop 177 Dresser Loop Co-op City ho na Edinkra for esi yetun safro obi bia oye ganani wa ma maka wa ma obroni beba wa ma American ni beba wa ma ehwan biom aigbeni ka awuzani yenyina ye Ghana for enye oli Ghanaians na eba Nigeria for eba Togo for eba Abidjan for eba other countries eba Europe for eba beji yani etimisro adenti na woma minia Mr. Bomodi, enjoy yourself kakra. Na beshe edinkra for Heroes Night Anaji coming Saturday. This coming Saturday between what time? Between 7 to 12. Ubahwa ubehu yenu abema oji. Ewo ho beba be wumi. Life is precious. Owa behu yenu aba wo ho. Mr. O life very precious. Stress and dawson into one what to be a good or one way you need or what no one ma wakuma at all yem because a dear chie ne radima di pebi chie ya yasidania di merade and you need penny and sa it is say uwonkwa na wade uwonkwa uwo bibia a chance can bills no de be a beba bills need the ochu mutan ebeba nanso ewo ho a ese uyibi eto nchen na odibi ejiwani because life is too short. Your life is very precious. It Mr. Wapomudi ehu hia me papa Mr. Ntinamatu, life is precious. Your life is very precious. Etebusian for Madam Asibebre. Not only that, eye bronya bow coming Christmas next month. Yenu abem eba se otun safre mo ewo Ghana. Obi bia oko Ghana watch ticket boy din papa and so amanfo eko which an in temo awaye ye because right now ticket running out ewo ho etibomodin sese oko Ghana na wan fa niema nko Ghana na pese ukodru Ghana kwaji wani wantimi anshepo niema anas ushipo ye kra na uhu achro upe bibia to ewa America niema yenua ba ese otun safro Yenuaba osi uba aye me pamucho osi mimisa se obia ope bibiti se oat ato upe soda ato anase upe anwa upe mu upe America niema toilet paper tissue paper bibiare wa America ha upe bi wo Ghana ato a ebi wo ho bra ho ubenya bibie bi ato esichiri organic esichiri anase upe apple cider for toilet paper and also pe bath tissue and now pe oye pansol bibi bia wo hwehwe ato America ebi wo Ghana osebra ho omahyepo ne mani nyina ebi wo ha eko Ghana omoton amayen ite hunya so beso anema no prices ni the same almost the same price emfa so bia ni so osebra beto niema what tomatoes corn beef fabulous upe Irish soap bibia ebi cranberry juice ukọ Ghana na bibia bi wo ho ose bra na beto ade ewo ho eniema ni bebre ewo ho pancake swipe pancake anaso upe your friend cream wheat bibia wo hwehwe Pepto-Bismol ukona uyam kekao upe Pepto-Bismol they stopoa ana tomatoes hand point upe tomato paste hands na ebi wo ho uba ho a goya adobo goya season na di aduane ma ne den ni nyina bi wo ho uba ho a oba ma bibia to ebo no eda form etese de oti America ha bibia o hwehwe ukọ ho asasto ni mu a ubenya so ni dinde FOB supermarket American shop FOB supermarket American shop ewo Ghana omuse bra upe Sam's Club eniema ana Costco niema ana upe BJ's niema ni nyine bi yedi bia akọ Ghana ho se men kan kyerem se mumra bronyeba emu jasmine rice no uba ho a ebi wo ho bibi bia hwehwe bi ewo America ha wantimi anto anko ana utimi toko na wa short bibi uye party uye adore o mane o mame o manu nuan mabusuafo ediane a from omode FOB supermarket American shop ewa Agbobi near Top Herbal Clinic ho Agbobi Road near Top Herbal Clinic. Omo phone number omo see mfantuja 024 77 38 511 024 77 38 511 and now say friend number we are on Sabecom and is 054 87 48 448 058 054 87 48 448. Misati mu biem omu say omu company ne de FOB Supermarket American Shop. FOB Supermarket American Shop. Wagbobi Road ne so near Top Herbal Clinic ho uko ho a omu number biem eye pacho eye 024 77 38 511 024 77 38 511 and answer be from 05487 48 448 05487 48 448 ufroma uniema no u Accra anansi wo outside Accra ufra eniema no omo de besika mo de abro eye be Accra, the whole Accra, not only Accra, but also call some o de call Kumasi enuane no o kan o frɛ na bibia wo hwehwɛ wo so nim no o fra omo de besika mu amaye de abro una obetua ka sika no omo se menka nkyerɛ mo abusuafo enyumre ye frɛ me life is precious nyame hiro bibia se mo nya madaje etie menni nyame hira mo asedanka erade enye na dum a enka ye ntiase ye tiase na ye na dum ne mo bro nye ba mo ma ye hwɛ ho so yie erade ma ye kwantenten o ma ya hoɔden o ma ye nije misro bomodi se weekend u beba eye Adinkra Heroes Night ma bi da bra na behwe na ye kama uba wani veje ye ma award bomodi twa ticket na bra behwe na ji wani be mengo with the Ghanaians ubenya a lot of connections ubenya wadanfo bi kura hu na che na beji wani nyame show bibia nyame adoma na watwi sabri ye be say share within the life is precious. I love you all. Please stay safe. Bye bye.